Compartment, what's the general action in most of those? Extension. What's the general origin point?
Lateral.
Lateral condyle, except you have other superficial ones, deeper ones that are going to be things like actions like supination, other things like more specialized thumb extensors, index finger extensors, and then little finger possibly. So that's maybe more found more in tea drinkers, right? British or something like that. Okay, so then that leaves us with the intrinsic muscles. And basically, with these, you just want to have a general understanding of them. Remember what we said this pad is here? Thenar eminence, and then this is what? Hypothenar. Okay, so you're going to have some muscles that are in this area that are going to work the thumb. Some are going to work more on this side of the hand. Okay, so they're going to be more for this finer movements, and you're probably going to be using those when you do your needle insertion technique and things like that. So then we talked about movements of the thumb, and then obviously we can know this is what kind of movement of the fingers. Flexion, extension. Okay, and then we talked about abduction, adduction. When you talk about abduction, adduction of the fingers, this is the central reference point. Okay? Anything that moves away from the center is abduction. Anything that moves towards the center is adduction. So technically, this finger can only move away from the center. It can only abduct, can't adduct. So it can't move into itself. Right? So this is abduction, and this is adduction, and then what's this?
As long as passwords.
Okay, so again, you got thenar muscles, hypothenar muscles, and then you have some in the middle of the palm. Okay, so those are more of the muscles in between the actual finger metacarpals themselves. And those are going to be lumbricals and interossei. The lumbricals and the interossei are going to extend the fingers, and whereas the interossei are just the ones that abduct and adduct the fingers. I don't know why that's in here because it's not an intrinsic muscle of the hand. We already talked about flexor pollicis longus. So here this shows all these different tendon sheets and things, and here's these different. This would be thenar. The other would be hypothenar. You don't need to worry about all the different names of these muscles. Just understand there's basically thenar, hypothenar, and then palmar ones that are in between the metacarpals. But just so if you want to know the names, there they are. Basically, they're going to have to do with flexing, opposing, abducting, things like that. They're named basically more based on what their action is. Okay, so those origin insertions are in the notes, but you're not going to be responsible for those for any of the questions in this class. Okay, so why do you need to know all these tendons and where to find them? Because this is where you're going to be studying later. Okay, to understand, you don't need to know point location for this class, right? This is not points class. This is just to kind of give you an idea of why you need to know some of these things. Because when you talk about some of these points here, it says on the radial side of the tendon of the flexor carpi ulnaris. Okay, so do you know where the flexor carpi ulnaris is? I hope so. So when you need to know this for these points, then you're going to say, yeah, I think I remember something about those. Between the tendons of the palmaris longus and the flexor carpi radialis. Okay? At the base of the styloid process of the radius on the radial side of the radial artery. So it does toss around some of these names, okay? So you're not just learning these just so that you know all the names of the tendons and muscles. There is a point to it. And it does have to do with Oriental medicine. It's not just Western medicine stuff. And so some of the things are more based on bone landmarks. Okay? Like here you have in the depression between the tip of the olecranon process of the ulna and the tip of the medial epicondyle of the humerus. Okay, did you guys learn where that is?
Yes.
Okay. The depression between the radius and ulnar on the radial side of the extensor digitorum communicans. So would you be able to take a shot at where that is? Okay, because we know where the radius and the ulnar is. You know where the extensor, well, I think in here we talk about it as extensor digitorum, but also another name is extensor digitorum communicans. Because like you mentioned in that video, a lot of these tendons mix and mingle, where it kind of makes a crisscrossing mishmash of stuff. Okay, so then we come over onto the front side and we're getting into the palm here. Okay? So the midpoint of the transverse crease is the proximal interphalangeal joint of the index, middle, and ring fingers. Okay? And the depression between the fourth and fifth metacarpal bones. Okay? So that's why you want to know all this stuff. But then also you get into these tendons and muscles if you get into more orthopedic medicine where you're talking about tennis elbow or tendonitis, things like that. So you also want to have an understanding of the muscles and tendons, the way they move for orthopedic stuff. Because one of the things, like in the notes where it has a little bullseye thing, there's one on the medial epicondyle. Because what does that have to, well, let's talk about this one. This one's more common. Okay, what kind of condition happens right here?
Tennis elbow?
Yeah, and it's also called lateral epicondylitis, although it could be condylosis because it's not always inflammation, so itis is inflammation. But anyway, so now you know that there's a lot of muscles that attach right there. So it would make sense that that's why there's a lot of problems there. There's extensor carpi radialis, longus, and brevis. Anybody have any questions?
Can you go to the snuff box one more time? As far as the two that lay right next to each other?
Yeah. I have a better picture of that. Let me just pull it up in another card. No? I had a better picture. Well, we can use this one here. So you understand, you go like this, and this is the snuff box right here, right? So go around and show you. So you got tendons on either side, right? So you see that. Okay. Is anybody that can't find their anatomical snuff box? And then you can do the same thing here, right? With the different, you can feel the different finger muscles. You know, if you do it in a different order, you feel the muscles moving differently. Right? Versus if you flex this way versus, it's not like you're going to pick out every individual fiber, but basically you can feel that there's different muscles moving when you move different portions of the fingers. And then also with the thumb too. And so there's thumb extensor muscles, yeah, so if we're doing anatomical snuff box, so you can feel that the thumb extensors you can feel here. And then again, it gets harder when you're talking about the thumb ones because those are usually deeper. So the ones you're going to feel better are going to be more superficial ones. So I'm going to pull up some of the stuff out of the trail book, so we'll go through some more palpation stuff. But I think we pretty much, it's just going to be stuff that we've already talked about. Because basically you know the different landmarks on the bone, right? Yeah, it's this. You get this. And what's that nerve that goes through here? Yeah, the ulnar nerve, because they showed that in that video where they talk about the different sheaths where it goes through, and then what's on this side. And then we talked before about the feeling the radial head. When you pronate and supinate, you can feel the lateral epicondyle is not going to move and the radial head is going to move when you do this. Let me pull this other one up.